Bismillahirrahmanirrahim. Today we will discuss the OSPE, which is a relatively new methodology of examining the students, uh, in which we rotate the students from one station to other. And there are three types of stations. One is unobserved station, where a picture or some medicine may be placed like this, and some questions are written. You have to answer to those questions. Second type of station is observed station, where you will perform a skill. For example, regurgitation test or marginal reflexes test for TOACS, and the examiner will just observe you, and he will have a key, and according to key he will mark your marks. He will not ask any question. Third type of session is observed interactive, in which, for example, there could be a skill like digital tonometry, and examiner may intervene and may ask questions. This is the format of the examination. There is no formal viva. Everything is covered in OSPE. Okay, this is almost all over the world now. This is being taken. So, in this session, we will just as you people have learned the skills which are which will be observed in your examination. In this session, we will learn those slides which will be placed on the unobserved stations, where no examiner will be there, nobody will be there, and you will have to see the picture or medicine and the answer to the written question. So, for example, this is a slide. Can you see this? And there are two pictures. In the upper picture, it is a picture of the cataract, and the question is written: what is the diagnosis? You should write cataract. It is of one number. How will you manage the patient? Now you should know that it is treated by ECC and phacoemulsification. Very simple. In lower picture, you can see it's a MRI, MRI of the orbit, and medial rectus muscle arrow is placed, and medial rectus muscle is enlarged. Which investigation is this? First of all, what is the most significant finding? You will say there is hypertrophy of the medial rectus. What is the most likely diagnosis? Hyperthyroidism. Okay. So now you see, I will go a little bit fast. You can see again a cataract, dilated pupil and cataract, and any question regarding cataract may be asked. Here it is written: what is the likely diagnosis? What is the stage? Which complication can arise if left untreated? So if a mature cataract is not treated, what are the complications? There are many complications. Most common is facultative glaucoma. Yeah, it is better to say lens-induced glaucoma, secondary glaucoma, because there are many types of lens-induced glaucoma, like facultative, phacomorphic. So, are you getting my points? Hmm? Yes, sir. Now, in the upper slide, you can see the fluorescent strips. You might have seen in the OPD, and these come these in a box. Questions written are: identify the picture. You will write fluorescent strips. Write its uses. Now we use it for staining the cornea, and we see in the cobalt blue light on the slit lamp, and if there is an ulcer it will appear green. We use it with proparacaine, which is a topical anesthetic, and it is used the for checking the intraocular pressure with applanation tonometer, where the miles appear green. Then it is used to see the tear film. When we see with the cobalt blue light, the normal tear film meniscus is seen. Normal is 2 millimeter. In dry eye, it is decreased. Yes. Fluorescent strips also. And there are many other uses of fluorescein. Uh, there is a fluorescein dye, which comes in injection form, 10% and 25%, which we inject in the cubital vein, and it is used for fundus photograph. We take the fundus fluorescein angiography to see any leakage in diabetic retinopathy or any other vascular retinal diseases. But those are injectable. We are right now talking about strips. So this is very important picture, especially the upper one. You can see it. This lesion, it is a patient old. You can, if you see carefully, and with the skin, you can find out that he or she is probably an old person, and with the non-healing ulcer for quite a few time, maybe a couple of years. Why I'm saying so? By just seeing a picture, because he or she is an old patient, because I can see the wrinkles and the ulcer appearance shows me the blood vessels alongside of the ulcer. So if you have studied the eyelid, then I told you lids and lid tumors. And what is the most likely diagnosis? So in younger patient, it is the diagnosis becomes different, and in older patient like 70 years, most likely diagnosis should be basal cell carcinoma or squamous cell carcinoma. Name three muscles present in the upper eyelid. This is anatomy. Okay. In the lower picture, if you can zoom it, uh, you can see there is a protruded cornea. Normal cornea is like this, and bring it to this normal uh, normal ratio. And this is the cornea normally. In keratoconus, the shape of the cornea becomes more conical, like this. So it's called keratoconus. So, in what is the likely diagnosis? At least three signs of this condition. You have read the cornea, then you must be knowing three signs: Munson sign, oil droplet sign, scissors reflex, and now this is. Remember that there are two universal colors in the eye. One is green and the other is red. Green is always the miotic. It conceals the pupil. And red is the alarming sign. It is always mydriatic. It dilates the pupil. It is a green drug, green top bottle, so it must be a miotic. And the most common miotic is pilocarpine. So even if without reading, you must know there is a possibility that we uh, mask this its name, and we want you to recognize it with its color, to see that to see whether you know the color coding or not. So pilocarpine, right, its uses uh, anti-glaucoma, especially in angular glaucoma, in which ophthalmic condition these eye drops are contraindicated. Uveitis, in uveitis it is contraindicated. Okay, and this is very important. If you can see, there is a corneal ulcer in a dendritic pattern, and dendritic ulcer is a hallmark of herpes ulcer, whether it is herpes zoster or herpes simplex. Usually, herpes zoster involves people above 45 years of age, and it involves the central part. Herpes simplex involves the peripheral part, usually. And this is the retinal detachment. The pink retina is the normal, and the white retina is the detached retina. And you will learn when you will go into the retina, the questions. But I would like to show you the slides which you have been through. So in this picture you can see that there is ptosis, there is not ptosis, it is the lid lag in right lower lid. It is a case of proptosis, and there is a sign which is called von Griefe sign. When patients' eyes are proptosed because of exophthalmos secondary to thyrotoxicosis, when he sees down, his upper eyelid remains at the upper place relatively, it doesn't come down. It is called lid lag or von Griefe sign. Anyways, it yes, you know what is trichiasis? Inward turning of the eyelashes. So you can see because of prolonged inflammatory marginal disease, and lower in the lower picture is the slit lamp picture of cataract, and the nuclear part of the lens is focused, which is opacified, and it is nuclear cataract. Are you getting with my point? Now this is very important slide. The right pupil is white, left is okay, and he is a child. We can see that he is a child. Now you will write the diagnosis leukocoria. Leukocoria means white pupil. It is very important. Not only to remember the term leukocoria means leuko means white, coria means whole. So white pupil. Now there are many other conditions which are asked here. You must know. First of all, usually in the younger age we ask, and it usually appears in younger age. The most important cause of white pupil is cataract, congenital cataract. Second is retinoblastoma, and it is very dangerous. And its typical presentation is at the age of 18 months. Before 2 years, it is very unlikely that the patient presents after 3 years. Okay, and it is the most common intraocular malignancy. Okay, in children. And last मुझे इससे याद आ गया, last yesterday I told you the most common cause of reversible blindness all over the world is cataract, and the most common cause of irreversible blindness worldwide is glaucoma. The most common intraocular tumor in children is retinoblastoma worldwide, and the most common intraocular tumor in adults is choroidal melanoma. Okay, you will study. So white pupil, the other causes are number one congenital cataract, number two retinoblastoma, then persistent hyperplastic primary vitreous, chronic, then there is toxocariasis, toxic, the mother, this is TOACS and investigation which is done. Toxocariasis, if it forms a glaucoma, it is a reflex from the distant tract. So toxocariasis, persistent hyperplastic primary vitreous Coats disease. It is a retinal vascular disorder, and there are many others, but you must know four or five. Now, as I show you the green bottle, this is red bottle, so it is a mydriatic, and green bottle was indicated in angular glaucoma, and mydriatic is contraindicated, absolutely contraindicated in every type of glaucoma. You can say even it's a crime if you give mydriatic to a patient of glaucoma. Okay, and the questions are on which parts of the anterior segment this drug acts upon. You must know the muscles. So it acts on sphincter pupillae. Therefore, dilator pulls the muscle. Enumerate diagnostic indication of this drug. We dilate the pupil and see the fundus. Enumerate therapeutic indications. We use it for treatment of uveitis. In which ophthalmic condition these drugs are contraindicated? Glaucoma. Till when the effect of this drug lasts? This tropicamide, its effects last for 4 to 6 hours. So you people have learned glaucoma? No. So this is the appellation tonometer, which is mounted on the in the upper picture, upper bar, and it is mounted on the slit lamp. Appellation tonometer, and this line chart, red eye. You must be knowing the causes of red eye. This is, don't go on the color. There are only two colors. This is proparacaine, which is in Pakistan it comes with the name of alkane. Alkane is the name of trade name. Okay, but you should say proparacaine, the active ingredient, which is a topical anesthetic, which we use for removing foreign body, for checking intraocular pressure. Even cataract surgery is now being performed under topical anesthesia. Then see the site of the lesion, and it is angry looking red swelling below the medial canthus. So it is acute dacrocystitis. So if you know the acute dacrocystitis, you will be able to answer. Which procedure is contraindicated in this case? Surgery. Don't, no, yes, that is also contraindicated, and never do the incision and drainage, otherwise it will form the fistula. Some people say it should be done, but in my experience, it should not be done. It 95% of the cases convert into chronic dacrocystitis, and then we go for dacrocystinostomy, because giving the incision will not do any good to the patient. The skills are written, which you people have already been through.